I want to welcome everyone to CKLU 96.7 FM. You're listening to the Learning Clinic. I'm your host, Robert Kirwan. And tonight, our special topic is dealing with special education. We're going to take a look at a number of things surrounding the special education system and process in the elementary and secondary schools in the province of Ontario. But we're going to look at it from the perspective of parents and teachers so that we can deal more with the feelings and with the I guess the challenges and issues that parents have to cope with when they have a special needs child and that they're trying to get the best situation for and get a fair education for those children who may need some special attention and some special needs in the process. So tonight my guest is Julie MacLean, who is a parent of a child with special needs, and I'm going to let Julie kind of give most of the background information on her situation. But Julie, welcome to Learning Clinic on CKLU 96.7 FM.
Thank you.
I'm glad you were able to make it in today.
Yes.
Julie, just to give us a bit of a background, what is your experience with the special education program with your child? And I guess take us back to how you discovered that your child needed special needs and some of the things you had to go through in order to get the services for your child. And then from there we'll just kind of talk about certain things that may be of interest to other parents.
Okay. Basically, Liam was identified pretty much the day he was born. There was issues with some club feet and that sort of thing, but of course we didn't realize how far reaching his needs were until he grew and didn't progress the way that other children progress. So as a mom, I was one of the ones that had, the baby books and, your 1 week old is doing this and your 1 month old is doing this. And I really had to throw them out after a while because they were very, very depressing. And I think there's any moms out there who have gone through this can find it just as frustrating and just as depressing. We were very lucky in the respect that our pediatrician, the pediatrician that was on call when Liam was born, took his case on. So we were really, really blessed with the fact that we didn't have to wait to see somebody. And from there, it kind of snowballed, and to be perfectly honest, it's almost hard to really remember exactly where things fell into place, only because it was very, very overwhelming at the time. I mean, there's so many acronyms. There's CCR and CCN and CTC, and they were all kind of being thrown at me, and I was never really sure sometimes which one I was dealing with and who came from where and what. But I know that we had some nurses, some developmental workers coming into the house, and they would do different tests with him to see where he was at, and of course give us toys and things to kind of work with him and try to help him, progress. When he was old enough, and again, I don't remember now which organization identified him to the CTC, which is the Children's Treatment Center here in Sudbury. It's just outside of, they've recently moved, they're just outside of the new hospital site now. And he was identified and he was accepted into their preschool program. So pretty much from the age of 3, he's been a part of their program. Their PATH program was preschool age. He was then accepted into the JK program and then the SK program as well.
So you got involved with dealing with your son's needs much earlier than most people would get involved.
I think so.
Yeah. So your particular situation was a little more severe than the norm in terms of special education programs are available in the school system?
I think so. I think from what I've just heard and seen, it's almost lucky, I guess, that he was identified so early on, because it enabled us to, I guess, get him started in programs earlier than some people who are, or some children who are maybe identified later. So again, I can't really stress how lucky we've been, if you can say that when you have a child with special needs. But he's definitely, you know, and even at the CTC, I mean, when he was in their school program, this past year he was in SK, and he went to Redwood Acres, and he also went to the CTC. So at the end of his JK year, we had a meeting to determine whether or not he could be integrated into a quote-unquote regular school system.
So this would have been an IPRC meeting?
Yes. So we had a discussion about his needs, where he's progressed, where he needs help, whether or not he could just be integrated fully, or whether he should continue at the CTC. It was decided that he would be half day at Redwood and half day at CTC. And when I say decided, it was a mutual decision. It was something that it was definitely discussed with me, and we actually live in Cape Rail, so his public school should have been C.R. Judd, but they at that point didn't have a special class, so he was actually accepted into the autistic class, and I can't remember what it's called. ASD? No, sorry. But now they're calling it an ISP class, which is Intensive Support Program. So, yeah, a lot of acronyms.
Absolutely.
But, yes,
So his official exceptionality then is, what's his
that's, basically right now we're at global developmental delays.
Global developmental delays, okay, so.
Yes, so basically it's an all-encompassing kind of thing, because we can't figure out what's wrong with him.
Yeah.
Or a specific diagnosis. He also has muscular issues because he was born with club feet, so there's a lot of physical issues as well as the developmental items.
Mm-hmm.
So he's kind of got a whole snowball effect going on for him. So when he was growing up, he walked quite late, and he's going to be 6 this year, and he just started talking. So there's been the communications clinic at the CTC provided him with a what they called a Minimo, which was a computer that talked for him. So he learned really quickly how to use that. It basically had little pictures that would say the word when you pushed it. So he could, say, I want cookies, or, I want whatever, what program he wanted to watch. And they had different folders for every different situation. There was a home one, a school one. So his cognitive ability, which was also tested at one point down in Toronto, is pretty much on par with that of a 5 to 6 year old. His understanding is right there. There's never really been an issue with that, but it's the communication and the other physical items that have been the issue when it comes to school and that sort of thing.